Good morning, ladies. Good morning to you. I'm going to be just getting myself all situated for this call this morning. It's so exciting to be having this conversation because when we started Sister Hold My Hand, one of the things I said to a lot of people was that Sister Hold My Hand was going to be the space where we discuss those conversations that women are wanting to talk about but were a little bit too uncomfortable to talk about. And today is no different. Today we're going to be talking about something that is very dear to my heart, something that I've actually come to know about lately, something that I never understood growing up as a young woman. I'm a big girl now. I'm no longer, just a woman. I'm a big woman. And that is the womb care. And as a mother who's given birth to two children and have been pregnant more than twice, having lost children on the way, I know how important womb care is, and not enough women are aware of this. Not enough women know and understand this. So whilst I get prepped for this, and I'm going to have an amazing guest for this today, I just came on pretty early to make sure that I can share this out to everybody. I want you to tag a sister, tag a niece, tag a friend, tag a woman who you know, because, more of us need to start taking better care of our wombs. And when we do that, we may have less cancers, we may have less infections. All of these things are pretty important for us women to learn about, to understand, so that we can, in our self-care, take better care of ourselves, and that would include our wombs. So in another couple of minutes, I'm going to be joined by my guest, Uduak, and Uduak will tell you who she is, but she specializes in all things woman. We're going to talk about womb care and yoni and, pregnancy and childbearing and all those kind of things that impact us as couples when we have a partner, but more so us as women. And I'm really excited about this conversation because in the group Sister Hold My Hand, and if you're not a member, the link is there for you to click and join us. It is a private group. I think it's even a secret group on Facebook where we discuss all sorts of stuff around women's feelings, women care, women understanding. And we made it private because we didn't want it to be a public domain that everybody can just see what we're talking about or hear what we're talking about. So if you are a sister and you're not part of that group, please come over. It's not Ava's group, it's our group. We don't sell in that group particularly. It's a private space, and it's a space where we are there to try and motivate and empower women to speak out about things like their womb, speak out about cancer, speak out about their emotions, speak out about sex and relationships, speak out about bra and hygiene and those sorts of things. So thank you, Bethany, for sharing the video. Because more of us, thank you, Karen, for asking to join the group. We are going to take everybody at some point later. So let me pose a question to you guys. How many of you knew or understand that your womb as a woman needs extra care? How many of us understand that women and our wombs need extra care? I know that most of you might be on the replay because a lot of you may be at work. Traditionally, this is done on a Sunday, but yesterday I was not available, and so I must apologize. Today I'm here and we are going to carry on because this show must go on. So let me just invite a few people myself to come and join us so that we can have the conversation, so that women can, come and learn, because I had to learn. I didn't understand much about womb care. And I know that a lot of women out there will benefit tremendously from this conversation this morning. So I hope my guest is around. I'm going to look for her in a minute. If you are there, Uduak, please invite yourself and come and join me so that we can talk about womb care. I really am excited about it because I need to learn more about womb care myself. I don't know enough. I've just started delving into yoni eggs and stuff like that because, we need to get proper balance and energy going on in our womb. So If you're there, yes, my guest is there. Awesome, 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 awesome. So welcome, welcome. I'm excited. Sonia, you're fixing your car. Well, girl. Hey, Uduak
Hey,
Udondem. Welcome back, my girl. How are you doing?
I'm good. How are you? How are you?
Do you know what I mean?
Happy
I'm actually
Monday.
excited about this conversation, and I was gutted we couldn't do it yesterday, but I'm really excited about it because I think that when I became enlightened and awakened to womb care, I was like, oh my God, they should teach it in high school to girls in PSHE class, because I realized that so many of us don't know. I didn't know anything about womb care. All I knew, Uduak, and you're going to educate us, was that in Jamaica you had a baby, and my mother would take a piece of cloth and tie her belly, right?
The belly
And
binding.
yeah, she would band the belly. And I understood that to mean that we're banding our bellies so that our bellies would go down. I don't know if that's the reason, but before we go into that, hold on, my Wi-Fi is acting silly. Because before we even go into why we do that, tell everybody who you are and what you do. Are you there, Uduak? I'm losing you a bit. Are you there? You going a little
I'm
bit
here.
fuzzy.
Can you hear me now?
I can.
Yeah,
So
I can hear the
welcome
connection.
again and tell us who you are.
Okay, so good morning or good afternoon. Good afternoon, everybody. My name is Uduak Udondem, and I'm originally from Nigeria. And I am a birth doula and a Arviga practitioner and a pregnancy massage therapist, as well as a yoni steam facilitator. I also do course training workshops on womb wellness. So my philosophy is empowering women on their journey to wellness and balance. So starting from the beginning, I started this path as a birth doula, and it really came from my own birth experience with my son. I had a home birth, and from there, I really wanted to share and tell women how everyone can have a home birth, you know, how
Mm-hmm.
wonderful birth is. So I went on to train as a birth doula, um, and my journey began. You know, a birth doula is a person, a woman who supports the expected mother during pregnancy, birth, and beyond. There can be a birth doula and a postnatal doula. I'm both, but I specialize more as a birth doula. And what we do is we really help women prepare for birth mentally, physically, and emotionally. We
Mm-hmm.
also give them antenatal sessions, um, and you know, it really varies. Birth doulas come in different shapes and sizes in terms of the skills that we have. My
Yes.
specialization is massaging, you know, touch therapy. You have birth doulas who are yoga teachers. You have birth
Yes.
doulas who specialize in homeopathy. So they bring a lot of external practices into their work to share with women and to help women prepare, you know, for that service, for that preparation, for that birth. Now, why do women have birth doulas? They needed that extra support. Birth doulas is traditionally what we called a woman, what our grandmothers or great grandmothers did in terms of supporting the female who's going to become a mother into motherhood. So it's really an introduction to rites of passage. We support her, we nurture her, and make her feel empowered. And that's what, you know, the traditional aspect of a birth doula is, which is also what a midwife does. But we do not implement any medical procedures.
Yes.
We give a holistic approach, um, advice, information that would really help them make better choices. And ultimately, so just give the woman and the couple a very a good experience of their birth, because it's really important to really have a very good foundation to not lead to trauma.
Let
Trauma
me
comes.
let me let me pause you for a second there for a second because I want to dissect this a bit. So my mother has 10 children, and all of them except one was home birth. So when I came to the UK and I saw where home birth was um, not normal, I mean, um, I suppose safety reasons and all kind of reasons, I was a little bit shocked because when I was growing up, majority of women had babies at home, and they would have, I suppose you call them a doula here. We had midwives come to visit them at home, grandmothers delivering babies, whatever. And we're not going to go into, I'm not medical, so I'm not going to say what is safe and what is not.
Mm-hmm.
But one of the things I know is that there is a higher rate of home birth back home in Jamaica. And I suppose, I don't know if it's the same in Africa or there has been that kind of record. But tell us a bit from your perspective. What is, and if you can't, I can respect that. What are some of the benefits to giving birth at home?
Well, the first benefit I can say from my own personal experience and working with women is being able to feel comfortable. It's really
Yeah.
important to feel safe. Women need to feel safe, and once they feel safe, it's all about acknowledging how you respond and interact with other people. Now, the benefits of another home birth is, it's because this is your space, your home, you're more relaxed. The progress of labor is a lot more effective and
Mm-hmm.
progresses smoothly, because now that you are in your home, you don't feel when you go to a space, you feel a bit tense because you're not sure, you're not comfortable, you're meeting people that you don't really know. So your body kind of goes into a natural tension mode, a defensive mode. And
It
with
does.
labor, the whole process of labor is to not be defensive or go in an adrenaline mode of fight or flight. What the aim is for to progress effectively in labor is the hormones that allow you to progress effectively, which is oxytocin. So home births is really about making you feel safe. If you think about when a cat goes into labor, she's in a dark. She's somewhere in
Mm-hmm.
the corner. It's very quiet, limited interference. Therefore, she's able to birth naturally. With us in hospitals, there's lights, camera, action, doctors asking you questions,
Noises.
midwives doctors opening your legs up to examine you. Even the procedure of examination is an invasive process, which I've seen with my own eyes. Women would be, say, 9 centimeters dilated, go back to being 5 centimeters dilated. Why is that? It's
Wow.
because our body permission, number one, is a lot of women don't understand how we don't allow permission for things to happen to ourselves and our bodies, and that
Mm-hmm.
happens in labor. So home births is really a natural setting, a relaxing environment. And for me, the best part is just going back into bed, whether you have the baby in bed or in your living room. It's being able to just have family come over, which is also a part of the extension of who you are. Um, it's also about just being, ultimately it's about being safe and comfortable.
I've never had a contraction, and people say I've cheated birth. I've cheated giving being a mother, and probably that is true. I had two cesarean sections. I've never had a contraction. So both of my cesareans were planned, but so I can only equate it to this. I cannot sleep in anybody else's bed. So if I come to your house, I find it really uncomfortable. I struggle to sleep. And I suppose I just even thinking about my cesarean sections, if they were done at home, which I know they can't, I'd feel more safe, I'd feel more comfortable because the hospital is noisy. It's people coming to pull your curtains every second. Sometimes it's by mistake. They're looking for the other bed. Sometimes people come to look for their family. They pull your curtain by mistake. It is just a very tense moment. You are prone to infections, and the list goes on. So totally accept that. And I really think that a home birth makes you heal faster in whichever way, because when you give birth, it's such a hectic experience, either whether cesarean or natural.
Yeah.
Your body has gone through something, and so you need to heal. And if you're in your own environment, I think that you are much more relaxed and safe. So if I were to have a baby again, which I'm not gonna do, and if I were able to, I would have tried home birth. It's one of the things that I really wanted to do when I had my daughter in Jamaica, but I had preeclampsia and all kind of things. But
Okay.
moving away from that, thank you for explaining that to us. Let's talk about womb care, Uduak, because trust me, there's still a lot of women who don't know, and I can say this unapologetically. There are still a lot of women, more less than we used to, But right now, there are still a lot of women who don't know anything about womb care, especially my generation. My daughter, who's 20, her generation understands yoni eggs and they understand all of that. I didn't have a clue at my age, even in my 30s, anything about womb care. So help us understand why it's important and tell us
Okay.
what you do around that.
Okay, womb care came really the expansion or the need for me to really share my knowledge of womb care came from my teachings and learning and my experience from my Arvigo practice. So I'm also an Arvigo practitioner, which
Mm-hmm.
is a traditional Mayan massage technique applied to the abdomen. So this is something that is done culturally in various cultures around the world. It's
Mm-hmm.
done by, like I said, our grandmothers, great grandmothers, they were the traditional midwives and they
Yeah.
were your doctors and your midwives now. So womb care
Mm-hmm.
is really important in terms of which starts from the very beginning of your transition into womanhood, your period.
Yes.
A lot
Yes.
of women, and one of my workshops is really letting women understand about their cycles, because a lot of issues that women have today stem from not really understanding the cycles and the benefits of the cycles, how it works, and how you can connect with your cycle in terms of empowering your divine essence, your divine energy, and also healing through that, and creating, making that space for creation, whether it's a physical baby or a manifestation of what you need to do in your lifetime. So
Mm-hmm.
womb healing, it's vast and many, but I always want to aim in starting by, or women come to me, when they come to me in my Arvigo practice about conditions such as fibroids or wanting to conceive, they have no real idea about their cycles and what's happening. Now, I have women who have cycles which are, in their term, it's normal, it's natural. They may be bleeding, having clots, back pains, PMS. We've grown with this understanding that this is normal, but really this is not normal.
It
All
isn't.
this, it's not normal. And taking the pill, contraceptions, all this have an impact on us when,
Mm.
mainly when we want to conceive, when we want to conceive, or when we are literally having such traumatic cycles that women go to the doctors and they say, look, you have an option, we can take out your womb. No, do not do that. Do not aim for that. But what it
Wow.
is that you want to
Why, can
tell.
you say why? Why shouldn't we have a hysterectomy? I mean, I'm not saying we should. And Jackie, I'm gonna come to your question, honey, so we're not ignoring you. Why shouldn't we have a hysterectomy? If you're having problems with your womb or things are not going well, why should you not have a hysterectomy? I'm not saying you should or you shouldn't. I'm just asking why shouldn't you?
I mean, the reason why, I say that in many cases is that we have forgotten the teachings of how we learned how to heal ourselves, because we have given that power to the male concept or doctors such as gynecology. Now, if you understand gynecology, it's coming from a gentleman who really studied the anatomy of women, and
Mm-hmm.
really initially started um, by using black female slaves to experiment on about our anatomy, and from there
Right.
he developed his practice onto white women, which he paid, and that's how the history of gynecology started. Now, by that, we're given our power to have somebody say, this is what's wrong with you, and this is how I can fix it. Now, a lot of conditions that we have is based on our diet, our lifestyles, the trauma that we may carry from our
Mm-hmm.
previous generation, or how we see ourselves, and how people are see us in this environment that we live in the system that we live in, and
Mm-hmm.
and taking the steps to learn and to heal ourselves is really important in learning your rites of passage in womanhood. Now, I wouldn't
Mm-hmm.
say, I have women friends who know what I do, but they still trust the system of a doctor to heal them. And I'm a very firm believer that we have the knowledge and the power to heal ourselves once we make that decision and choice to do so. A lot of women who do go through the stage of having a hysterectomy, especially I met a lady who was a nurse, and she said that it was the biggest mistake she had ever done, because every year, the dates that she had that procedure, every year, she feels that her body goes through that trauma every year of
Wow.
her womb being removed. And that's really, and that's what they call, is it ghost? I can't remember how they call it. But what it is that even though something physically comes out of you, you will still feel energetically.
Wow.
And she
Thank you,
feels,
Jacqueline. We'll catch up with you as well later. We're going to answer your question as well. Thank you for joining us. Sorry about that, Uduak. Somebody was saying bye. Yes.
so a lot of the times that it's even having your womb taken out, it was, even though doctors will say, well, you don't want to have a children, you've had children, you don't need it. It's really vital you do need it, because it's one of the brain power of our bodies, our hormonal systems. It's really still functional, needed when you go through the transitional rites of passage of your menopausal stage, your eldership stage, which I like to say. So it's really, really important that we learn to heal ourselves in a process over time. When you have something taken out through a surgical procedure, the healing process varies and it's different. We don't, sometimes you have to go through the pain in order to see the benefits. And if you have had a hysterectomy, I mean, it's still a choice down to you, but I do offer women as many options and the process. But it takes time to really go through that healing, because you don't know that maybe were you vaccinated when you were born, taking a pill when you were 13 or 14. Many things could have contributed towards your.
Can we dissect that? Because I want to talk about that. And you read my mind. It's really crazy how you did. Because I've never done contraceptive, hormonal contraceptive. I've never done it. I've just never, I have a psychological mental block. I can take the biggest evening primrose oil tablet. I can take the biggest vitamin C tablet. It will go down. Spoonsful of sugar is not needed. But give me a tiny contraceptive tablet and I could never take it. I don't know why. I've never been able to do it. Trust me. And I think it was mental for me, because in my mind is telling me this shouldn't be going in my body, right? And that's just me personally. And I understand that when you're putting anything you put in your body is absorbed, right? So when I'm putting in these hormones in my body, in my mind, I'm disrupting the natural flow of the hormones that are naturally given to me. And we're not going to go into the pill and its effects, because I don't know that it's not good for you, right? Any tablet you have to take in your body that is made by pharmacies over time is not good for you. You know that, right? But when you are giving girls, if you start from me, let me ask you this question. What are you doing to your body and your hormones if you're taking the pill from age 14? And say you're 30, is that impacting your womb? Is that impacting your hormones? Is that impacting your body? And some doctors will say you have to take it because of X, Y, Z, and W. I'm not going to start on my whole concept of pharmaceutical and the conspiracy of pharmacy versus the morgue and whatever. We're not going to go into that part, because I have my own theory. But is it, and I know you're not medical, so I'm not going to put you in that position, but from your own perspective, let's just use our caveats here to protect ourselves. From your own perspective, do you think it is wise for young girls to be taking the pill that early? The other thing that I challenge, and I know that this is probably womb care too, is that HPV vaccine that girls get at a very early age. Do you have any opinions? Let us get the word clear, opinions on those.
Okay, so taking the pill, I don't agree. And it's funny because when I was 13, 14, I took the pill not for contraceptive reasons, but for reasons in terms of hormonal balance. And this is the thing I didn't know. I didn't know the impact it would have on me at that time. Or I think I had POS. I can't
Polycystic
remember.
ovaries?
Yes, I think I did because
You
what I
had
did,
polycystic ovaries, right? No, that's important for me. You had it?
you know, I went to my doctors a few years ago just to look at my whole medical history, and it did say that I had it, and I was like, oh, I didn't know I had it. So
But
I've
you
been
have
going.
babies, and they say you normally can't have babies if you have polycystic ovaries.
I've known women who've had polycystic ovaries and have had children, so it is possible. Um, but like I said, my timeline, I changed a lot of things in my diet and in my lifestyle over the 40 years that I have been on this earth. But I know that I had, there were symptoms that I had, which I didn't really know, but in my medical records, it did show that I had polycystic ovaries. So, and then from that time, I can see that looking through my lifestyle, I made various changes. I stopped eating chicken. I don't smoke, I don't drink, not as such, but I changed a lot of elements in my lifestyle, which I feel contributed to when I did get pregnant and have my children, it was possible. You know,
Why did you mention, can I just pause it? Because you know I'm going to dissect everything.
okay,
Why did you mention chicken? Do you think chicken's a contributor?
definitely, definitely, because um, I was in Atlanta a few years ago, and someone was telling me, chicken, it takes about 6 months to raise a chicken from, mature stage, whereas in a lot of the factories, it takes 6 weeks. The hormones that they put in there that to grow these animals, and when they die, you eat them. A lot of the foods that we eat have estrogen filled foods that we eat have an impact on us, especially this generation. In the past 20 years, our lifestyles have had an impact on our fertility,
Yes.
or our wellness of our womb, or our fertility or ability to conceive. Women and men also, let's not forget that men
Yes.
do have challenges as well in
And
terms of
I
fertility.
must say on that note, I just saw a documentary recently, and I was really shocked that when you open a can of beans, there's a white thing around that film. There's a white when you open tins products, especially baked beans. There's this check again that is apparently they're putting estrogen to preserve stuff in tins. So it's not just affecting girls; it's also affecting boys. So there
Yeah.
are lots of products around that have actually are very estrogen filled, and boys are taking them as well.
And this is the thing, I definitely, in my Aviga practice, when I am looking at women and they come to see me in terms of wanting conceive or balance their hormones, we definitely go through a home care modality program of what are you eating, what can you change, even your household products, what you can change in that, the nail varnish, the hair products to a degree. I really kind of go into that. I'm working with a few women
Wow.
and to them, you've got to take this out, take that out, and see how you go in your cycle. Because what will show the impact of the food that you're eating is through your cycle. Whether
Mm.
the cramping sensation, whether you're clotting more, how your emotional well-being is prior to your cycle. All these will show that what you're eating has an impact. I have a friend who is now recognizing when she does eat chicken, she bleeds more. So it's
Well,
like,
can I say this to you? It's amazing you talk about what you eat because I remember that I used to have an 8-day cycle or a 7-day cycle, and that's not normal.
mm-hmm,
You're not meant to have such a long cycle. That's what I think I understand. And I used to have a lot of pains and cramps, and it was terrible. And when I changed my diet, my cycle changed, the
mm-hmm,
cramps changed, the pain changed, and I became more comfortable. So I
yeah,
cut out red meat from my diet. I cut out dairy products. I'm still trying to get cheese out. It's really been a hard one. I cut out dairy products out of my diet. I started buying organic foods.
yeah.
I do still take chicken, but it's organic. And I'm praying that they're not lying to me. But I can see the huge
You can see
difference
the
in,
difference. Yeah.
in my children's lives, in even my kids. I can see the
Yeah,
difference.
yeah, and this is
So,
this is really important that we are our first. I see that in my lifestyle as well. In my home, my children. I have 3 children, 17, 14, and 3, and I'm really mindful that when I notice these changes in me, and we eat all the same food, how's it impacting them? You know, they're going through, you know, I'm looking at their fertility, you know, I'm looking at my grandchildren who have not been born yet. You know, how is it going to impact them when they grow up and are ready for that step in their lives? So it's really important to really see things. And if, I mean, also with food, but with the lifestyles, like I'm very much mindful. Like my 14-year-old, they like to put their laptop on their laps.
Oh, no, no, no.
Take it off. You know,
you're damaging your womb by having the laptop right there.
Exactly. And you know, he's 14 and he's like, but why? And I have to sit down here and tell him about, you know, his sacrum and, you know, his fertility and his sperm, and he gets embarrassed. But, you know, he knows these things. And it's
well, really can I just tell you what? Yesterday I was lying in my bed and I was I plugged in my Mac and I was lying there and it had a long cord and it stretched across the bed and I just forgot that it was there. And I was lying and I felt something really sting in my thigh. I had on pajama pants, so it was long, but I felt this sting and I felt like a bee had stung me, and I'm even touching it now. And it dawned on me, oh my God, the damn thing is in the bed. And when I got up, that laptop charger, that, you know, that chunky part of it was burning me. It felt like a bee, like a bee had stung me. And I thought, my God, can you imagine having a laptop on your leg, on your thighs? Because that's what it really does. The burn was deep. It was, even now I'm touching, it's hurting me. So sometimes, I know we're kind of segueing on this, but sometimes we don't even realize that these gadgets are affecting our wombs.
Yeah. When I was pregnant with my second child, you know, back then we didn't have Wi-Fi. We just had plugged in. So the vibration was different to my pregnancy 3 years ago. And you know, every night I would turn off the Wi-Fi from the plug. So it felt like, you know, if you think about the Matrix, you know, when everything goes down, I always feel like once the Wi-Fi is switched off, everything is all that electric energy has just dropped. And it's really important that we have to really think about the environment we live in. There's some people are a lot more sensitive than others, and we know this through things like crystals. Some people can feel the vibration of crystals other than others. So for me, I'm very sensitive to all these energies, and I really wanted to kind of go back to, you know, my second pregnancy's dynamics and lifestyle of not having too much energy around me. When I'm, you know, in my room, I have no TV, you know, I have no phone. And when when I go to bed, my phone is outside, the laptop is outside with my children, everything is outside. We don't sleep with any electrical gadgets in the house.
I'm glad you say that, because in my house, and my 20-year-old is hard to get her to do it.
Yeah.
But I really tell her she has to make that choice.
Yeah.
She's old enough to make that choice. But you can't get me after 9 o'clock on my phone.
Mm-hmm.
Because and there are nights when I switch off my Wi-Fi. I don't always remember to do it, but it's downstairs, and there are sometimes when I do switch it off. And my phone is on airplane mode from 9 o'clock.
Mm-hmm.
You cannot get me on it. There's nothing to it. It's off.
And that's self-care practice. That's your need for self-care, because what you're doing is you're putting yourself as a priority, and that's you're nurturing yourself by setting boundaries from the outside world. And it's really important to learn that in so many ways, whether we do that in work, as women, as our own being, as sisters, as mothers, you know, it's setting boundaries. And this is something that I'm learning, you know, because I have, you know, when you achieve one goal, another one comes in just to test you. So it's really about learning to set boundaries, which this is really the foundation of what self-care is.
I want to bring you back to Yoni. You just talk about crystals, and I want to bring you back to, because we could talk about the energy fields that we could go on, and there's so much that we need to talk about. You might need to come back.
Yeah.
But for those who are just joining, we're on Sister Hold My Hand. We're really talking about womb care, but womb care is so dynamic.
It's so big.
It is so big, like seriously, because you probably just caught us saying that we're talking about how the laptop and the energy from that can impact your womb, and for your husband, your sperm
Yeah,
count and his fertility. And
yeah.
Uduak and I are looking at our grandchildren, and we haven't seen them yet, but we're saying if our children don't start caring for their bodies and their wombs and their sperm count, we're not going to have any grandchildren, frankly.
Let me say something. It's really important, and just to note that, and a friend reminded me of this because she knows I'm all about women. She says, "Did you know that when you were in your mother's womb, from maybe 3 months onwards, Idara was in your womb." So not only was your mother carrying you, she was also carrying Idara, my daughter's name. That's my daughter's name. So the history of our energies and just how powerful our womb is, that from 3 months or 3 to 6 months, the fetus already has that energy of
Yes.
our children. So the way even the way you carry your pregnancy, or even the first 3 to 9 months of preparation, is key. It's really key.
Wow. That is crazy that you said that, because yesterday my daughter came into my bedroom, I was getting dressed, and I'm almost gonna cry at this because this is so synchronized. And she stepped on my bed. I said, "Mommy," and she said, "Mommy, feel my foot." So my daughter has had a lot of health complications. We're working on them. And she said, "Mommy, what did you do? Why I'm so sickly?" She actually asked me that. And I was getting dressed to go out, and we started talking about my pregnancy with her. And it was a very tumultuous pregnancy. It was so tumultuous. And in my book, I spoke about it. I used to walk around with a 5 pound paper bag of medicines when I was pregnant with my daughter. And it was gravel and this and that, and I couldn't keep anything down. And it has impacted the child I gave birth to, right? And we were having that discussion yesterday about this same conversation. And I was then educating her that when you are pregnant, how the pregnancy is impact what you give birth to. So you
Yeah,
can't plant peppers and expect to reap pumpkin, right?
yeah,
And so it's amazing that we're having this dialogue and this discourse right now, because my daughter and I had that conversation yesterday. And I said to her that when I was pregnant with you, I was very depressed.
yeah,
I was a very depressed pregnant mother, and my daughter has episodes of severe depression. I was very unhappy. I was in and out of happiness, unhappiness, imbalance. It was a very unbalanced, imbalanced pregnancy. And I can see how some of that has manifested. Of course, we're working on it, obviously. But
yeah,
as she gets older, we're seeing how it's manifested in her hugely. My
yeah,
son, when I was pregnant with him, I was ill, but I was hyperactive. I was so hyperactive. I was doing a job in the city. I was rushing all the time. I was like a this. My son is extremely hyperactive. And I can tell you, don't I'm not listening to anybody talk about ADHD or whatever else. Because not that they've said that, but I'm not listening. I knew the pregnancies I had.
yeah. It's there's so much. I mean, there's different layers to when you understand the psychological, emotional, and physical impact of the birthing woman, the female, the womb, because there's so many layers, and it goes from, like I said, physical, mental, and even down to the blood. Our blood is such a powerful essence, and I'll go back. It starts down to your cycle, you know.
Mm,
Starts down to how and it's really important that we start learning to teach our um, girl children how to initiate or make that transition into womanhood. When I was starting my period, and I had a very challenging childhood, and even my when I first experienced my period, I actually thought I was dying because
me too.
I didn't have my
Me,
mother.
me
I didn't have
too.
my mother
I
growing up
thought
with.
somebody cut me. I was like, oh my God.
Yeah, but then, yeah, so when I was growing up, I had very challenging family dynamics, and my mother wasn't there at the time. So when I had my period, which was a very young age, I've never really spoken about this, but I had my period at a very young age, 9. I felt very alone. And so when I found out I was bleeding, I just thought, I felt it was such a bad thing. You know, I was
Yes.
dying. I felt like I had been cursed. And you know, it that initial transition into to your period sets a foundation for you. And and I forgot about this. And when I went into my learning and about womb care, someone asked me this question, and it just came back, and it just
Wow.
poured over me like, wow, you
Wow.
thought you were dying, and I had to. It's taking. I'm still processing it because it's
Wow.
making me understand how women, you know, you can have women who are, you know, like now they do celebrations like a bar mitzvah, right? Why this is so important to let a girl know her transition into womanhood is so precious, and who she is and who she's becoming to be. I didn't have that. You know, I had to learn.
Mm.
I had to go through so many ups and downs in my lifetime, so much
Wow.
trauma to
To
really
get
come to
there.
really embrace myself, who I am, because you know, I didn't think my worth was even valuable when I had my period, because you know, when you think you're dying, you don't really think it's a good thing. But there's so many um perspectives I can see from it, that you
Mm-hmm.
know, when we bleed, we die and we are reborn. But if someone came
Wow.
and taught me this, and in such a knowledgeable and a holistic and nurturing way, you know, who knows the type of female I am. But then the female I am now is because I'm here to teach. I'm here to teach and share. I'm
Yeah.
here to really kind of give that perspective of womb care and womb wellness. And sometimes we have to go through the bad times, the shit times, to show that lesson. So
I
I
like
accept that.
I like what you said about, and I really believe that is important. I don't think it's done because even in my opinion here, having taught PSHE here in schools, I have the impression, and this is my impression, and I'm very careful about how I select my words on this. The impression I have of how the rite to passage is taught to girls is that it's preparation, that if you go wrong, you can have a baby. That's how it is taught. It's
Yeah.
almost scaremongering that you're gonna have your period, and if you're not careful, you're gonna get pregnant. That's how it's taught in my view. Whereas it's like you said, it should be taught to girls that it is such an important transitional phase of your life, and not one that you should dread and be fearful for,
Mhm.
but one that you should be able to tap in and tune into, and prepare yourself for, and
Yeah.
understand that what you do from henceforth can impact so much of who you become as a woman. And I
And the
think
most,
that's not
yeah.
taught.
And most importantly, who you interact with, who you choose, and why is it important who you choose to let into your being in that process. Because I do feel that, you know, how the menstrual cycle or a menstruating woman is seen today is, oh, she's moody, she's on her period, oh, you know, why is she taking a day off, she's only bleeding, you know. When people see us, when we go through these stages, they don't see the behind the scenes of what we're going. And sometimes we don't even understand what's going on, but we do know that there's a lot
Mm-hmm.
of pain, there's a lot of confusion, there's a lot of, we're weak. Most of the time, women who are bleeding, we're weak, we're tired, we know,
Oh
we're very
God.
emotional, and sometimes we don't even know why, because we haven't had that building block set in, um, and that understanding put into place. So when we are seen by, you know, our husbands, our boyfriends, our job, our bosses, it's, you know, it's down, that's how it's downplayed, and it puts us down as women, you know, how society see us, that, you know, she's on her period. It shouldn't be like that. And we even take that as, oh man, I just can't stand my period, I just can't wait until I'm not bleeding. We don't even see the value of when we are bleeding. You know, we don't
Wow.
see it. And when we bleed, it should be a time of not letting we should be locked in our rooms and just be in our own space. And I've you know, working with doing my own journey on my womb care, I've really gone through some amazing insights of and knowledge of how, and awakening of my womb. And I just really want to share it, but I know that it comes in stages. And one thing I do know
Wow.
is that we have a lot of information there, and our womb is just waiting to kind of share with us. And when they say that it's a portal to the universe, I'm telling you, it really is a portal to a vast universe. We are so connected in so many ways that it's amazing. But what it is that it's down to self-care, setting them boundaries, knowing our power, nurturing our power, nurturing ourselves. There's so many factors to it that has to
Tell
come.
me, tell me, because I'm conscious of time and I'm conscious I want to come back to this. So tell me a little bit about yoni eggs, and I suppose my question would be, tell me if women who are watching the replay and watching live right now,
Yeah.
or when they watch this whenever, wanted to get five, or let me not go five, three important things that we can do to care for our wombs, what would you say that those are? But also, how does a yoni egg come into this? And after we get that, we're going to kind of look into how we can connect with you and what you do, and then we're going to wrap down. So tell me three things that if you were to give me the three easiest things, and I know that the womb care needs more than just, Uduak give us three things on Facebook Live on Sister Hold My Hand, because I know it's deeper than that. You don't care for your
Yeah.
face by just giving it one scrub and say, oh, well, it's perfect. It's maintenance, right? And I know you
Yeah.
do that with women. So tell us three things that we could walk away from this right now as it relates to how we care for our womb to prevent illnesses and all kind of other things. And also, how does a yoni egg come into this? Because I want to have a yoni steam, girl. I'm telling you, I'm planning one for Sister Hold My Hand. So for
Yes.
all those who are listening, Sister Hold My Hand, I'm still looking to do a retreat. If you're interested, please inbox me or go to the group and comment. I want to plan a retreat for about 15 women, just 15 of us who are really interested in adding yoni steaming or yoni care as part of that retreat. So over to you, Uduak. Tell us about three things,
Oh,
and
three
how
things.
does a yoni egg come into it? And do you have a yoni egg there? Do you have one?
I have
Oh
two.
my God, can I see them again? She's prepared. She has one.
I
Can
have
we
a
see
collection.
them?
So this is
Mhm.
nephrite
Wow.
jade. Yeah. So
Mm.
this is my own
Girl,
personal
that
collection.
is big. That's
It's,
big.
I think this is the large size, medium to large size. So this is my own personal collection. I actually do sell yoni eggs. I've just recently started, and it's really because my clientele have just made that request. So and this is my rose quartz. So this is medium. So, I've always been curious. I love crystals. I've had crystals in my life, in my home for 10 years now. Just decorations, put them on my pillow, in my bra, either they're on me or they're around me. And they've given me great lessons and helped me to connect with myself a lot more and heal myself really and truly. So the first three things I would say is make that decision to wanting to heal yourself, recognize it, and affirm this, saying that I have the knowledge and the ability to heal myself. You've got to,
Mhm.
I feel it's really important. I've been saying that since I was a young woman, that I have the ability. I don't know how, but it's just knowing that you have the ability and the time. Remember
Yes.
that a lot of us need to make that time and that commitment, and know that it's not going to be an overnight process. You know,
Hmm.
took us, it takes 9 months to, in fact, they say it takes 9 months to grow and nurture a baby. It actually takes 12 months from the concept of the mind. But, it could take a lot longer to heal yourself
Yes.
from that acknowledgement, and be prepared to make that commitment, because we have 3 cycles in our lifetime from being a child. We get initiated into womanhood in our teenage years, then we have that phase of from our teenage years to our 30s, and then we have that phase of motherhood, that if we go through that cycle, and then we have the initial phase into eldership as through menopause. So there's different cycles of our lives that we
Hmm.
also need to learn and understand, that it takes time to recognize that, and really just start I would say even just action, put our hands on our wombs, and just breathe into her and just say hi.
You
Just
know,
by saying
I hold her and I tell her thank you. I
yes,
actually thank my
yes,
womb. I
yes,
thank her. I bless her. And
she
I do that.
appreciates,
I do, and I appreciate her.
and she
And and
yeah.
and that leads me up to this question.
Hmm.
Um, a very sensitive one. For the women who don't have children and cannot give birth, I think I met a woman recently who felt that womb care wasn't for her because she wasn't gonna have children. She cannot have children. And I was trying to say to her, no, it's for all of us who have a
That,
womb. We have to
yeah.
care for her. How do we dispel that myth or that, I don't know what you call it?
Like I said, it's still for her to make that journey, because it could be a case of she's battling that she isn't a woman because she can't give birth. But
Mm,
having a womb is not about giving birth physically. It's about giving birth and manifesting what you perceive. A lot of women who say they want to have children, they've had that thought for a long time. Um, and some may have had challenges to get to that point, and some may haven't. But women who can't have children or choose not to have children also, um, they also need to recognize what they're here for, what their purpose is. And the womb
mm,
is about, it's the center of your creation. A creation is manifesting anything you want. Remember, we're here, we're guides, we're teachers, we're students. We're here to share, and learn. That's my philosophy. Maybe that's how I am, how I see myself. So women
wow.
who is not learning, who's not able to have children, recognize that there's so much you can give, and still say thank you to your womb, still connect to your womb and say,
Oh, girl. Do you have
no,
like an affirmation? Do you teach in your classes that women must affirm to their wombs and say
oh
thank
yes,
you?
definitely. And I have
Because
to say, this is coming from, yes, I do. My
I
wellness,
do that.
and and the more you do that, and this has come from a combination of all, our Vigo work, my doula work, my pregnancy work. I also do Reiki. Everything that I've applied to my for other women, I've applied to myself, and more. And I've learned to say thank you, or even just learn to breathe into her and just wait for the answer.
Oh,
And it could take maybe like a day, it can take 2 days, it can take a month, or even take a year. And remember that sometimes everything we are asking for, we know the answer to, and that's because it's within us, within our womb. And I've had like realizations of something I remembered that I've questioned maybe 10 years ago or 5 years ago, and it's come to surface because I'm just learning to connect and set boundaries and nurture myself.
thank
So
you. Uduak, we are running out of a bit of time, and I'm gonna have to have you back because there are several things I want to ask you. I want to ask you questions like, when women have several sexual partners, what are we doing to our wombs? I mean, like seriously, I'm gonna have to bring you back because, and somebody just inboxed me and said, Ava, you have to bring her back. And I'm staring away because I'm reading. Hi Ava, great topic, great guest. You have to bring her back. Great question about the women who don't have children in their womb. But Ava, I wanted you to ask questions around, you know, multiple partners. What are we doing to our womb? Are we nurturing her? Are we killing her? Are we damaging her? There are so many questions coming up. People are asking questions here that they're afraid to put on the Facebook Live. Thank you for the questions. I'm seeing them. Somebody's asking me questions around yoni egg. So if somebody wants you to address the yoni egg question that we asked a
okay,
while ago.
quickly.
And
So
somebody
one
was quality. One second. Somebody was clarifying. Did you say you sell yoni eggs? Because I
Yeah,
wasn't
so
clear either.
so on my website, I've just started to sell yoni eggs. It's really geared. It was really geared towards my Vigo practitioners, so my Vigo clients, and just questions of, do you sell yoni eggs? Have you tried them? What are they like? And even for me, I had questions about yoni eggs. I was curious about them, and I was like, how does it work? Who can I get them from? And I purchased my first yoni egg 2 years ago, 2.5 years ago. And it was an experience. And
Can you tell us about it? Like, because I've never had a
okay,
yoni egg.
okay.
So,
So the
so hold
first
on.
time,
I'm single, right?
uh,
And nothing is going up there at the moment. So I'm really single
it's
for for
amazing,
quite some
I have
time.
to say.
So tell me about yoni eggs. I want to try them, but I'm not, I'm scared. Not
Yes.
scared, just I'm not scared. That's a lie. It's a new thing for me. To tell us about it. What is it for?
So yoni eggs is are crystals formed in the shape of an egg, and it has many benefits. Strengthens your pelvic floor muscles. It releases trauma. It heals. It helps you connect with your womb space more. Um, like reflexology with the hand and feet and the face, we have different points which connect to our body parts. The womb and the cervix, the uterus has the same thing, especially the cervix and the vagina. It has muscles which are connected to the kidneys and other areas of the body. So, and a lot of women experience trauma through that. And it's for me, I wanted to explore yoni eggs because I wanted to go through my own healing journey, and release a lot of trauma from my childhood and even my
Mm.
adulthood. I just wanted to release. I had a difficult pregnancy, and my relationship with my daughter's dad was very challenging, and I just really wanted to learn to release and heal my trauma. And also, when I was 13, I actually I was in a car accident, and I do recognize that the impact of the car hit my right side. And because I do a lot of energy work, I realized that my right side is quite stagnant, and it has impacted my womb side, my pelvic floor side. So the work I've been doing my yoni egg has made me acknowledge that more, and make me want to seek more alternative practice to help me adjust to that. So the womb egg, the shape of it, one thing I'm going to say is that depending on the way you insert the egg will help you release the trauma or energy, or help you bring in energy, depending on the size, depending on which direction you put the egg.
So what
The very,
direction is for what?
so the small pointy side is helping you. I think it's helping you bring in energy.
So when
Bring
you
in,
go up,
yeah.
yes.
So and the wider side is helping you release energy.
Like
And so,
draining, it's like a draining position, isn't it?
yeah,
Like a
it's
draining,
where
yeah.
you kind of go out. And sometimes my eggs, I chose to have eggs undrilled, because you can have eggs drilled, undrilled, and I chose not to have them drilled. Mine's are undrilled. And my
Okay,
first,
what does that mean? I mean, I'm what does
uh,
drill mean?
so drilled is that it has a hole, the pointy side, it actually has a hole where you can insert a rope, or like that you when you put it in, you can pull it out yourself. So one of the things that a lot of women are experiencing as to, oh, I'm not sure about a yoni egg, is because is how is it going to come out, or is it going to, where is it going to go, or is it going to get stuck? And that's a lot of questions and concerns a lot of women had, even I had. So when I first put the yoni egg inside me, I was like, oh my god, how do I get it out? And those are the questions that we have. And how long does it stay up there? What do we do? How do I take it out? It comes out when it's ready. It comes out even when you go and empty your bowels. There's so many times it may come out. I've had experiences when my egg will come out if my energy is not right. You can have intimacy while you're using your yoni egg, and that's also another thing. It helps enhance your sexual
Wow.
mix with your partner. It really does. And that's another element. So the different crystals have different purposes and
Okay.
releases different energies. So I
I've
have
got
rose quartz here and
yes.
nephrite jade. So on my website, I sell 5 different types of eggs. I sell the rose quartz, I sell bloodstone, unakite, and nephrite jade. And it's really hard to get nephrite jade, or the genuine nephrite jade. And it took me a while to really find one that was genuine.
That's the question I was about to ask you, because somebody just inboxed me. Hi Ava, great concept. Love her knowledge of the eggs. How do you know that they are genuine? How do you know to buy them from genuine suppliers? Because nowadays China makes everything, even food.
Yes.
Thank you for the question. Yes.
So with the nephrite jade, I had to definitely just kind of look around, just ask questions. Just, the World Wide Web is a vast way of information, and it took me a long time to really find one. And also I had to work on my intuition. I had to work on my intuition and just kind of learn that is this correct. And I already have left right jade, my own personal one, which I bought in this country. So I had that and was just seeking advice from professional crystal practitioners to help me kind of get that guidance and authenticity from
Next
there.
question, which leads me to dropping your website when you're finished under the post. Somebody asked how much are your eggs, what the price range. Uduak will be dropping her website link here, so you can go there to buy them and make sure you have them.
Yeah.
Uduak, I know that you do a lot of work with women, and I know that you'll teach them how to put their eggs in. I know you'll tell us how we can find you. Do you have any special offers for Sister Hold My Hand? It's such a deep conversation. We could go on and on, because one of the things that I want to come back to is around trauma and the womb, because the womb carries all of our trauma. I know that, having gone through trauma myself, having done a lot of work on my own womb. Somebody just asked a question. Hi, Ava. Would you consider having the retreat around healing of the womb and stuff? It is part of what thank you, great question. It is part of what I plan to do with the retreat. Obviously I can't go to the retreat by myself. So once I have enough women, it sounds like Uduak will be there with us once we pull that together, possibly. So drop the link here for us, Uduak, and tell us how you work with women, and then we're gonna wrap up.
So I am based in Northwest London, and my Orvigo practice, women come to see me in my location. My pregnancy massage, I go to women's homes around London, because I believe it's really important to kind of help the woman, the expectant mother, feel comfortable. My birth doula practice, I work with women in their home settings and helping them prepare for their birth, and whatever hospital they choose to have their babies, or in fact whether they choose to have their babies at home. I've just finished doing an event called the Curly Treat Fest in July.
I saw that.
So I talked about the yoni steam. So I also do yoni steam. I also facilitate yoni steams for women, because a lot of women don't have a real clear understanding and guidelines to how to use yoni steams or the herbs and how it can help them improve their cycle. I'm going to be doing a talk on the 29th of September with a lovely lady called Nicola, and it's the Goddess Discovery Retreat, and I'm going to be talking about womb care there, and it's going to be held in Birmingham. So I really wanted to kind of drop that, because that's the next time I'm going to be talking. So it's awesome. the Goddess Discovery Retreat on the 29th of September. I will be talking about womb health, everything from massaging, yoni eggs, the waist beads, how to connect with your womb, affirmations, and any questions that anyone has to ask me about yoni steaming. Yes, that's what I'm going to be. That's the next time I'm going to be talking.
Yeah, wow. This has been so much. I feel like we've done a whole year worth of work right there, but that has been so informative. Thank you so much, Uduak, for being here. I really just believe that the womb is just the mitochondria of a woman, and it's not just for women who have children or plan to have children. The womb needs to be cared for and nurtured, because the womb radiates, there's so much that comes out of it that determines your mood, who you are, whether you're a mother or not. And I think that more of us need to start taking amazing care of it. I love the fact that you're so experienced. You can tell that I feel when you were talking, I could feel the knowledge base, which is so powerful. Because oftentimes, we're not talking about, the hair follicles and the eye and things that you can physically see. We're talking about the womb that is invaginated to some extent and not easily seen. And a lot of us walk around with our wombs and not caring for it. Not realizing that we need to care for her. She is important, and we need to bless the womb, and we need to talk to her. So thank you so much for coming here. Uduak is going to be dropping her link and the event link for where she's going to be talking. She comes to your home. She started off by saying that she does, home birth is important for her. So she comes to your home to do your massages, your pregnancy massages. And when I was pregnant with Chardonnay, it's called Lamaze. We call it Lamaze. I don't know if that's what you call it. But I used to go to Lamaze classes where it was exercises and massages around my pregnancy. And it was so helpful for me, although I didn't have a natural birth. When I was in that theater, I was breathing because they had taught me breathing
Yeah,
exercises.
yeah,
So as a
yeah.
doula, I think that is so important for people to have those care. Now, I really wanted to answer Jackie Thompson's question before I run because I didn't want her question to go unnoticed. What is the data to show that home birth heals faster? And we didn't say that there's data. I
Okay.
was saying that, you
Okay.
know, please do.
Well, the reason why you heal faster is because you're in your own natural environment. And you're able to, when you're in your own natural environment, your body is able to process that healing aspect. You bleed. You're not, and the people around you is also it's very important when the people around you are the people that you recognize.
Mm-hmm.
Traditionally back home, it's important. When my mother had my children, they used to put her in what they would call the fatting room, and what they did with you in terms of massaging you and nurturing you, it helps her feel connected to this lineage of who we are as women and what we need to do in terms of how to become mothers. So
Mm-hmm.
I feel, and another thing which I did when I had my child was I did a lotus birth. You know, a lotus birth is when the cord still is connected to the baby. Sorry, the placenta is connected to the baby after birth, and it comes off naturally when the placenta is ready to come off. So that made
Wow.
me stay home for a good 5 days, and what that does is it helps you make that connection and that bonding with that baby, which is really important. Where in hospital, which they do have, if you are able to stay in hospital more than 4 days, that connection and bonding is not as strong, and it helps with the healing process. Like when you're building a house, you have to have the foundation, you put the bricks, the windows. It takes time to piece you together. It takes time. The 9 months your body was opening, and now it's going to
Mm.
take 9 months to 12 months, or even 2 years to close you back. Hence what you did
Wow.
with the binding, the wrapping. That's what was.
Ooh.
So it's about giving yourself that time to heal naturally and in the correct time that is needed. And
And the correct space and the correct environment. And I think your home is
yeah,
correct.
yeah.
Whew, girl, I want to thank you, goddess. I want to really thank you for this. It's been
Thank
so
you.
enlightening, and even for me, I really want to do a retreat that really encompasses or includes this whole womb care for women, because a lot of us are going through so many stuff that we like at the moment. I just had surgery in May for endometriosis. They didn't find it, and I'm still having this pain. And then we realized that when I gave birth in the hospital, the cesarean section in itself was not taken care of properly, right? So at the moment, we're having a lot of tests because within the scarring, there are issues, in the tissues. So, there's a lot. If they had taught me proper wound care then, I wouldn't be having this challenging
Yeah,
time. But thank you so much for coming
you're
on
welcome.
Sister Hold My Hand. I found it very enlightening, very, very enlightening for me personally. And I'm not going to have any more babies, but if I were to have it, I would have loved to have tried home birth. I want to encourage all the ladies who are here, not just those who have baby, those who are in menopause. Your womb needs some
Yeah.
care. So I suggest that you speak to Uduak, look for her links, connect with her, and take the conversation further. Thank you so much for being here, and have a good
Thank
day.
you. Have a lovely
Thank
day
you.
and have a lovely week. Take
And
care.
for those of us who don't know, Sister Hold My Hand is a private group where we really discuss the conversations that are a bit uncomfortable for some of us women. The link is in the post, so if you want to join us, you have to request to join. It's not a public page because there are some things in it that we want to stay within ourselves in the group and among the ladies who are there, where it's a community of care and share, and that is how it's gonna be. Have a great week, and I'll speak to you guys later. Bye bye.
Bye.
Bye bye.